Good afternoon, everyone. Just wanted to talk to you about a new quality improvement project we're doing, and it's called the Stop for 5. And what this Stop for 5 is about is a hot debrief tool that we can use here in the emergency department. So what is a hot debrief? So we know that team-based resuscitation in the emergency department is an excellent opportunity for hot debriefs to occur. And so in creating a hot debrief model for emergency resuscitations, we thought to optimise learning from your own clinical experiences, identify the team's strengths and challenges that they face throughout the encounter, and encourage a model of honest reflection and focus on ways that we can continually improve for future performance or resuscitations that we can have. And that's why we've created this hot debrief model that's been used in a few emergency departments around the world now for a few years, and it's been quite validated as something that's quite good. So it creates this interactive structured team dialogue and is to be implemented immediately or shortly after a clinical case. And once again, it's designed to learn from our experiences, reflect on what went well, identify strengths and difficulties and ways that we can actually improve for the future. So the Stop for 5, so this is where you take 5 minutes after a case, and so it gives you this framework of how to actually conduct these hot debriefs. So that's what we're looking from our clinical nurses and our senior doctors to be able to, and some of our senior nurses to be able to run some of these hot debriefs using this tool. So some of the indications that you may use it for, and you don't have to use it for all these cases, so post-cardiac arrest or an ECMO patient, post a major trauma, any challenging resus cases, whether there's a death in resus, or any staff triggered requests. Okay, so staff will encourage them to actually trigger and use these requests out on the floor. So the Stop for 5, so the stop actually is about the first letter S is about summarising the case. Then it's about focusing on the things that went well. We're then looking for opportunities to improve, because that'll allow us to have a culture of excellence and moving forward to actually always looking at ways that we can improve for that next patient. And from that, we want you to actually fill out these forms and summarise it. And filling out there is the points to action and who's going to be responsible for us. And then we ask that these forms get left in the SRN tray at the shifty desk, and the CNS team will actually take courage of these forms and ensure that the points or actions are followed up and put in place for those next cases. Before starting one of these Stop for 5 hot debriefs, you want to ensure that you've got psychological safety. So the first thing that you should do when bringing everyone into the room is thank the team and ask is everyone's okay. And if everyone answers yes, then it's fine to continue. And that's about explaining to them that we're going to have a 5-minute team brief. And the purpose of this team brief is to improve the quality of the patient care. And it's certainly not about a blaming or adding blame to anyone from the case that's just been had. You encourage your staff that their participation is welcome, but it's not actually compulsory, and that all information that is discussed will be confidential with them. This is what the form will look like, and this is what will be kept in a file at the shifty's desk. So you just take out one of these forms and you fill it out. So it just gives who was involved, what was the case, and then it's about summarising the case, the things that went well, opportunities to improve, and then the points or actions for the future that we can actually look at. And then this will go into that SRN folder for us to follow up on. And the potential benefits that we're actually hoping for from implementing this Stop 5 hot debrief tool is that we want to improve staff morale and team cohesion, so amongst medical staff, HSA staff and nursing staff. It can also be outside agencies, could be with the police or with St John Ambulance, Wilson's Transport, anything like that. We want to improve care for our future patients, and that's a big thing. And this is about promoting a culture of excellence, continuous learning, patient safety and quality improvement. Please come and see any of the CNS team or nurse educator if you need any guidance with this tool. Thanks all.